Welcome to Atrium Health Navicent Knows Health. I'm Cindy Busby and I'm here today with Dr. Tim Stapleton. He's board certified in orthopedic surgery and he's subspecialty certified in sports medicine. And today we're going to talk about his practice here in Central Georgia. Dr. Stapleton, thanks so much for being with me.
Thank you.
Would you first let the audience know why you picked orthopedic surgery as your specialty?
Well, I started off in family practice, actually. I went to Mercer Medical School, and I'm from South Georgia. I wanted to go back to South Georgia, and at the time, I liked every field, and I thought I'd be a family practice doc. I actually started a residency in the Air Force. I was in the military, and then I realized partway through my first year that I wanted to fix something. And the problem with older people in the world of medicine is they still get sick and die, no matter how good the doctor is, and I wanted something more, fulfilling to me. And so I entered a field of orthopedics in the military. I spent 10 years in the Air Force. I've been Macon since 1997. I've been Mercer's primary team physician since then, so I'm coming up on 25 years this summer. I love what I do.
Tell us a little bit about your relationship with Mercer as their sports medicine physician. I know that there are certain sports that you did historically and maybe different ones now.
Well, true. When I got here in 1997, Dr. Kelly and Physiatry Orthopedics had been covering Mercer. Mm-hmm. One of the reasons he recruited me was I had gone to Mercer. I had been their undergraduate, I went to med school there, and so I was essentially coming home. And one of the things that he promised me was if I came back to Macon, Georgia, I would be their team doc. And so that was one of the reasons I came back. I love Mercer. I mean, I went to school there. My wife went to school there. One of my sons went to school there. And until about 7 years ago, Precise Street and Ortho Georgia merged into one bigger group. And then I had partners who actually were also sports medicine trained, and Mercer got football. Mm-hmm. I'd covered all the sports for 17 years, and then I had a PA who helps me tremendously. I couldn't function without Steve. He's phenomenal. But all the sports combined were not what football does. When you add football, you add so many new injuries that I needed some help. And so now one of my partners covers the basketball. I cover everything but baseball went to one of my partners. He covers softball. Another partner covers soccer, men's and women's, and another partner went to lacrosse. And I appreciate their help, and I kept everything else. Mm-hmm. But football and basketball are my loves.
And what's the role in that case of the sports medicine physician? Is it oversight over the program from development and injury, or is it injury assessment, more of an acute role? What is that for you or your partner?
A little bit of both. We work with Mercer Medicine, and the training program that Mercer has with their many trainers in various sports are my left hand. Steve is my right hand, my PA. And so my job is to make sure that if a person gets hurt, I can't go to all the games, obviously, although we attend all the football games because there's so many injury, all the home basketball games, and then we assign various coverage based on the injury rate for that sport. And you want to treat them on the field as best you can, but there's not a whole lot you can do on the field except get an initial evaluation of what's going on. Mm-hmm. If there's a concussion or something that is non-orthopedic, then we have other docs on the sidelines to help with that. Mm-hmm. And then our job is to treat that problem, whether it be surgical or non-surgical, and then get that athlete back into playing capability. To say I can make somebody as good as they ever was is not true. I can fix things, but God does all the healing. And sometimes that healing takes months to years. And some injuries you will never get back as what you were. And so all we can do is all we can do. But our job is to get the athletes back on the court or field as soon as possible. Mm-hmm.
And do you also have a role in the management and development of programs? So I'm guessing they're seeing medicine as a cornerstone of their larger program because training and treatment of injuries is so important. I just wonder, do you sit at that level, or are you more operationalizing what they need you to do?
Well, I'm on the Mercer Athletic Foundation board, which does some of that supervising, but the key decisions are done by the athletic department, not really by me. They sometimes consult me, but not necessarily in that role. It's more helping athletes either after an injury or with some of the programs to avoid injury. Mm-hmm. There are many injuries you can't avoid by proper training programs. ACLs, for example, are a major injury in sports. It's a decimating, I mean, you're out at least 6 to 8 months, if not longer. And there are preventative programs that Mercer and other programs around the country have instituted that have been effective in trying to help avoid injuries as best we can. And Mercer does a great job with that.
So let's switch gears to your practice and specifically in sports medicine, but I know that you have a lot of thoughts about sports medicine in terms of the treatment of athletes and their performance, and also the treatment of non-athletes, or the idea of the person who wants to just continue a hobby or sport that they have in their life. So can you talk a little bit about those two pieces? First, maybe the teenage or young adult athlete that you're treating.
Well, recently I did a 13-year-old ACL who was going back to play football. And I also have done 3,000 total knees in the last 30 years. And I've done about that many rotator cuffs. And to me, an older person who can't play golf anymore, who maybe can't ski anymore, who can't do the things that he loves anymore because his knees are so bad or his shoulder is worn out, if you can replace or refurbish, reconstruct, especially total knees. I think total knees are one of the coolest operations that we have in America today. I mean, a year ago, I had 2 total knees myself. And a month ago, on the 1-year anniversary of my total knees, I was skiing at Vail, doing some of the easier black diamonds, but I was skiing down, having a great time. And I love to do that. So to return an older person to golf or skiing or whatever his love may be, is a huge part of what I do. And mostly the surgeries that I do are knees or shoulders. That's where most of my practice lies. But we work on hips and ankles and elbows and other things too. It's just the vast majority of injuries and surgeries that we do are either knees or shoulders.
So when a patient comes in, do you find they're coming in the sense that they see themselves as having an opportunity to be, treated in the sports medicine side, or do you think they come in and they have arthritis in their knees and it just so happens that they don't play golf, or in their shoulder and they don't play tennis, but in your mind you're framing it in terms of returning them to activity?
Well, the first and foremost, our goal in orthopedics, I think in medicine, is to help people be less painful, okay? Function is a whole nother discussion. Whether someone's anatomy and physiology lets them get back to a sport may or may not happen. But if a person can't walk because his knees hurt so bad, or they can't get out and work in their garden, they can't work in their yard, they can't walk their dog. I mean, there's so many things. Shoulders hurt more at night. And to be able to sleep, whether you're an athlete or not, that's a huge thing. And so shoulder reconstructions, mostly rotator cuff repairs, and total knees, which are mostly in people over 60 or 70, you're trying to restore quality of life. And to me, it is sports medicine to get a golfer back on the golf course, or a walker back walking his neighborhood or walking his dog, because that's something they love, and they can now do it with less pain.
So when you're thinking about this continuum of how even people walk in with this pain, what are you telling your patients either before they have an injury or before they let the pain get too bad? What are some of the things that people can do to prevent injuries that land them in your office? And we're not talking about high velocity or falls, but more taking care of your bones and your ACL.
Okay, I'm glad you asked that, because there are 2 very important things that I try to get all my patients. Once you get 40, you need to fall in love with a stationary bicycle. I'm just telling you right now. A bicycle is the best thing you will ever do for the lower half of your body. Jogging, while it is good for your bones and it is good for your muscles, it is not good on your cartilage. You see, when a lot of my ladies, for example, older ladies, have osteoporosis, and they need to walk. They need a weight-bearing exercise to make their bones harder. And most any exercise will make your muscles stronger. But the question is, does it protect your joints? And the answer is that most exercises don't. Non-weight-bearing exercises, such as a stationary bike or swimming. Swimming is fantastic for your upper half of your body, and biking is great for the lower half of your body. So I try to get all my adults who want to stay active, especially just walking and going to Kroger or doing whatever you do on a daily basis. A bike is something that everybody, in my opinion, once you get 40, you should do the rest of your life, because it burns calories, it gives you aerobic fitness, and it protects your cartilage. Whether you get a metal joint or not, you got to keep it moving. And swimming is great for your shoulders, and it's great for your back too.
And you find that, I'm guessing, because people are living longer and they're staying more active, and you're seeing more and more people either come in not only because they're living long enough to have a joint replacement, but they may live long enough to have a revision or another joint replacement.
And that's just as important. Once you get a metal joint in, especially a metal knee, that's the most common joint that we do in this country, you got to protect it. I mean, even when I was skiing here last month, I'm very wise in choosing what I'm going to, what I'm not going to do, but I love to do it. And if you can do something without injuring yourself or putting yourself at risk, that's what quality of life is. And so you got to protect what you have. When you get a total knee or even a rotator cuff repair, you have one good chance to get a great result. If you tear it up, and sometimes you have an accident or fall and that's nobody's fault, but a revision of anything is never going to be as good as what it was the first time.
So as a final question around, once you've had this replacement, this surgery, this procedure, talk to me a little bit about rehab and the role, because you mentioned that you've got one good shot to get this right. So rehab?
That is the most important part of what I do, is trying to tell people surgery for a metal knee takes an hour. Recovery takes at least 3, 4, 5, 6 months. And a huge part of shoulders and knees, which is the basis of what I do, is going to therapy. You start therapy on the 2nd or 3rd day. And you're doing therapy. Whether you go to therapy is not really the point. You have to do it. Therapy is not a place. Therapy is an education. Therapy is what you do with your shoulder and your knee every day, the rest of your life. And you have to keep it strong. You don't want to overload. I got a lot of guys who want to lift weights. And weights are fine when you're young. When you get in your 30s or 40s, I tell my weightlifters, never lift more than you weigh. Because the guys want to bench 300 pounds or they're not manly. Well, that's not good on your shoulders. But if you bench less weight and do more reps, you can protect those joints and get stronger. And the same in general. Working out is a huge part of staying active. It's been proven that depression is treated by exercise as much as it is drugs. And so quality of life is getting a joint that doesn't hurt and getting it to work as best you can. And that's what rehab does. So rehab is more than the surgery, is the crucial part of recovery.
What do you see on the horizon for, we've moved from, you went from open total knees to more minimally invasive to quicker return to work to unicompartmental. What do you see as, the next 10 years of what these adults who are living longer can imagine?
That's a good question. Last year when I had my knees done, I was introduced to a new type of skin closure that I had never seen. And now I do it on all my patients. And it doesn't involve staples. It involves a superficial thing that you put on the skin that gets them moving on day 2 instead of having to wait for the staples to not pinch. There are all kinds of innovations that come out all the time. And our job as surgeons is to have an open mind and not get stuck in the way we've always done it. And I must admit that I had, because I had been doing total knees the same way I'd done them for years. And when I decided I wanted to get some, I wanted knees that would let me get more active, and there are different types of knees that do that. And so I think the innovations are ongoing. Only God knows the future, but I think it's a bright one.
Well, if we have anyone who was watching today who wanted to talk to you about, they may have pain, they may want to return to performance, how would they get in touch with you? What's the best way?
Well, our office, 743-3000 is Ortho, Georgia. That's one of the numbers. And I have a team there that's very, very good at getting hold of me. And we have openings in all the time. Different insurances cover this and that and the other, and that's another issue. But love to have them. Love to see patients and love to see patients get better.
Thank you. Well, thank you for telling us so much about your practice.
You're welcome.
Appreciate it. And thank you for joining us at Atrium Health Navicent Knows Health. If you'd like to know more about Dr. Stapleton and his practice, please visit us at atriumhealthnavicent.org.